Dr. Youdeem, welcome.
Good morning. How are you?
Good morning. Well, it's afternoon for me, my friend, but good morning to you.
It is morning in
So
California. That's what.
it is morning in beautiful California, and I'll lay out an agenda for us today. And it's good to see you again, by the way. So
Thank you.
what we're going to do today is we'll cover, I want to hear a little bit about your story and how you arrived at, this world in which you're seeing. I mean, I feel like I get a new video from you like every week of patients who are walking out of your office who, I mean, they walked in and they were like, "Could you help me?" And they're walking out going, "This guy changed my life." And so, what I want to know is, I want to know your story. I want to know where you came from, where you are now, and ultimately how we got here. And then in the second half of the call, what we'll do is we'll take some live Q&A from the audience. I have a bunch of questions that people have been asking me for weeks, and hopefully you can be the guy to answer them. So we'll start with just,
All right.
why don't you introduce yourself and tell us a little bit about where you're located, your practice, and how long you've been there.
All right, Gilbert Youdeem. I'm a chiropractor in Southern California. Been practicing 27 years this month. And
Let's go. Congratulations.
thank you. And actually, we're coming up to my 1 year of having StemWave in my office. So we're close to that. I think June was when we started with StemWave. I'm in Southern California. I'm in Cypress. So
Nice.
I have hi, Dr. T.
Hey, buddy.
Yeah,
You've
got a special guest here for you.
in the pilot seat, Dr. Youdeem. All right.
Yes, sir.
I love it.
All right.
So you started practicing 27 years ago. This is the
Right.
month. It's all coming together now. And if I remember correctly, you've had StemWave for how long now? Is it
About 11 months, I think. 11, 12
about
months.
11 months? Yeah, I
We're
figured it's
coming
been
up
like
on
a
the
year.
about a year.
And when
So
you
what had
called us
happened
a
was,
year ago, yeah. So why don't you tell us what happened?
so what happened? I needed some CE credits. There was a doctor who had the StemWave machine at his seminars. I had seen a video of something similar, and I was curious about it. So I went to the seminar. I've been suffering from some neck pain. We're getting massages and chiropractic and everything else, but I was still not getting better. And I went to a seminar and I had the opportunity to try it there. So I'm a very skeptical person. So I don't usually jump on,
You don't
new
say.
technology. No, not at all. So I tried to stand wave at his office. I slept great that night. I woke up the next day and I was amazed, and I thought, no, this is not happening. This is not. Let's see what happens in the next few days. And for the next couple of weeks, I was feeling better. I was like, hey, this is something I should look into based on my own experience of what happened to me. I still at that point didn't quite know enough about shockwave therapy. I didn't know much about stem wave. I had an opportunity to go and meet him a few weeks later. I talked with him a little bit more. He told me the conditions he was treating, and that's when I came back and I did my research, and I did into shockwave therapy and all the different machines that are out there. And so I had tried StemWave, and it worked. It was great, and I dove into it more and more. And I think I pretty much made my decision to purchase a machine within a month after my second treatment.
And tell us about, like, how did your office run prior to StemWave? Because StemWave is a completely different type of modality that you added in. So, like, what were things like before? Were you just doing chiropractic? Did you have other technology?
So we're primarily just chiropractic office. We have decompression machines, but the frustration was some of the conditions that come into your office that you can't really treat anymore, especially knees and some of the shoulders that were more challenging. Patients come in, you can offer them massage, you can offer them adjustments, you can offer them ultrasound or muscle stim that all gave them temporary relief, but nothing similar to what StemWave can do for them. Nothing similar to what StemWave was achieving. So we brought patients in. We started within our own patient base, and pretty soon it was just kind of took off.
Yeah,
And
tell us how that happened. Like the stem, you kind of go through this situation where you try it, it works really, really well for you, and you're like, okay, well, let me do the research. Well, what did you find in the research that stood out to you?
I read all the positive reviews that I saw. I saw began to understand how it works. I could probably still tell you how it works, but um, some of it is still a mystery, guys. Some of it is still a mystery to me. But the patient response is what really um, stands out for me.
Yeah.
It
I
gave me
mean,
another avenue of being able to help people. And I tell you, like I said, I've been practicing 27 years. Your body gets tired after pounding on people for 27 years. I'm a single office. Every patient that walks into my office, I get to treat personally. I touch every patient that comes in. We don't offer anything else that hey, they come in and get massaged by somebody else or something else and they leave. So I'm a very hands-on person. And even with StemWave, I'm the one that's administering it because I'm still a hands-on patient, a doctor for my patients.
yeah.
So that's another reason why it attracted to me.
And so you went through this whole thing, and you've been primarily hands-on, you've been running your business as a solar practitioner, and you said, I guess I'll just give it a shot. What were you nervous about prior to doing it? I mean, you had tried it yourself, but of course, like, it could get results for you, but were you nervous that it might not get results for others? Were you nervous that maybe it wouldn't work out financially? Like, what was going through your mind?
Um, Surprisingly, no. I wasn't worried about the financial aspect of it. I was not too worried about the financial aspect of it. It was a concern, but it's just I knew that when I talked to StemWave, they said, "Hey, you're gonna recover your return on investment within 3 months." Um, well, okay, it was actually 3 months and 10 days before we before we actually got the return on investment. But excuse me. But the patients responded well. Uh, so there was I didn't have that concern. It just worked out so well.
And when you introduced it to them, like, what were some of the cases that you initially started seeing some really good results within your initial patient base?
We started with knees. We started with knees and shoulders. We did
Okay.
plantar fasciitis. We did some ankles. We did some posterior shin splints. Um, I didn't I didn't dive into spinal right away. It's neck and lower back conditions. I In the first probably about 3, 4, 5 months or so, I concentrated on knees and shoulders, and then as I became more comfortable with the technology, as I became more proficient with it, as to what this can produce, the kind of results that it was producing, I said, okay, let's try the lower back, let's try the neck, but still primarily a lot of shoulders, a lot of knees, a lot of feet and ankle issues, and then
Okay.
sacroiliac joints, lower back conditions.
And like, how did it, a big concern that I guess a lot of people have is they don't know, how this is going to fit into their day to day. Like, they've been running their business, whether it be, a PT business, a chiropractic business, a pain management business. They've been running it for so long in a certain way. And it seems like this new device that looks completely foreign to them is going to go in their office in a different room. Like, how am I going to adjust my schedule? Like, tell me, like, how did you approach that? Because you'd never used anything like this before.
It wasn't. It especially because since I am hands-on, it initially pulled me away from the rest of the practice. So what we did was we started having certain dedicated times to do StemWave. We opened up a few more hours during the week to be able to accommodate more StemWave patients. It was all in the how we scheduled. And as the office became more proficient with it, you can actually set certain times during the day or during the week that you can say, I only see StemWave patients at this time.
Okay.
And it 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 takes a little bit of trial and error on your part to see how you can fit it into your office, but it does work. You can set time aside And yesterday, I had a patient came in, for example, we didn't have any StemWave appointments available. It was established patient who came in. It really, the mapping takes, it's so quick to do the mapping, so quick to get some results with the patient. I was able to take that
Why don't you
appointment that I
describe
said,
what that is, by the way? Because a lot of people here might not know what the mapping is or the initial visit, or could you describe kind of what that initial visit looks like with you and what you're looking to accomplish and just how you run it in your office?
well, this patient was established patient, so I already knew what was going on with her. But any new patient that comes in, we give him an examination. We do a thorough history to see what's going on with them, to see what the condition is whether there are, if there are any contraindications. Which, by the way, there aren't too many contraindications to StemWave. All right, and figure out whether they're a candidate for it or not. At which point, explain to them how the machine works. I tell them the loud bang that it makes, but it's okay. And we use a little gel. We put the machine on the body part, let's say the shoulder. And as we call it mapping, but it's really a treatment at the same time. We go around the body part and we look for that biofeedback that we get, where the patient says, hey, I have a little soreness there. When you become really good at it, before the patient even tell you where the issue is, you can tell, you can hear the sound, and you can tell the patient, this is where you're sore at. And they're kind of amazed, like, how do you know? I said, well, listen to the sound of the machine. The machine tells you where the damaged tissue is. The machine tells you where the inflammation is, tells me where your pain is, because the sound changes. And some patients actually start picking up on that. That mapping session, we use a couple of hundred waves to find where the pain is. And then I just tell them, hey, I'm gonna do a treatment with you now. So I do a couple of hundred more sound waves, and I go continue the treatment. The treatment versus the mapping or trying to find where the damaged tissue is, it's not much different. But to them, I tell them, this is what I'm trying to find where your issue is. Now I'm treating it. And afterwards, we have them go through the range of motion. We establish what motion might have been painful for them or what activity they weren't able to do at that point. And afterwards, we take them through the same positive ortho that we had, or range of motion, and they can say, hey, look, I can feel better. I don't have as much pain, or I have no pain.
And tell us, like, number one, how long does that take? Number two, what are you looking for to say to yourself, like, hey, this is a really good patient that I think I could help a lot?
The process doesn't take that long. I mean, every practitioner is different in terms of how long it takes to do the examination. We can do a very focused examination, about 5 to 7 minutes, if that, in that body part. And the mapping and treatment session takes about not even 5 minutes to do. But it's basically, let's take the knees, for example. Patients who come in with knee issues, they have a lot of arthritis in their knee. They've been told they're bone on bone. Sometimes I just take them and I put them in front of my X-ray machine. I say, hey, let's take a bilateral knee shot from you, and we can look at the amount of degeneration or arthritis they have in their knee, and that's what we determine. I asked them, what is their goal? What is it that they're trying to do that they're not able to do? I can't go for the walk. I can't bend over. What is the activity that's really hindering their lifestyle? And that's what we determine. That's how we determine whether we can help them or not. Because we know, for example, for the knee, we know we can help patients with knee. So
you want to see if their goal based on their condition is something realistic based on what you've seen and what you've seen with other offices and in the studies, if it's something you're going to be able to help. And then you build a care plan for them. And tell us, like, how many visits are they going to be coming in for? How are you setting that up? How are you structuring that?
the care plan is usually between 8 to 12 treatments. I've found that most patients do really well with about 10. Those who don't do as well, we do the 12 treatments, so maybe a little bit more. There's a protocol that we learned from StemWave, and I've actually pretty much stuck with that. It works pretty well. We treat them a couple times a week for the first couple of weeks, once a week after that. There are patients, there has been a few patients that they're after even twice a week for 2 weeks. They're not quite where I think they might be. So I might do it twice a week for 3 weeks, but still 8 to 12 treatments. We set a goal that at that point, how much improvement we want, usually 50, 60, 70, 80% improvement. Once we've achieved that at the end of the care plan, then we talk to them regarding a maintenance plan or to further treatments to keep it going. And as a matter of fact, once they see that how much better they feel, then they sign up for a package for the whole year, as far as coming in and getting treatment once a month, once every couple of weeks, to continue to heal.
Okay, awesome. Yeah, and I'm glad we got to, I mean, the technology does wonders, but the big piece of making all of this work is the training. And so, if anybody's here on the video, you can see that handsome guy, Dr. T right there. I believe he did your training. Is that right, Dr. Youdeem?
Yeah, we did,
Oh,
we
he's hiding
did
himself.
weekly training with Dr. T. So he's
May have trained a couple of the doctors that are in StemWave now. Yes.
Yes. Dr. T is famous for training hundreds of doctors who come through StemWave. So Dr. T, I appreciate you joining us here today. And, Dr. Youdeem, I'll ask a question that we get a lot is, you mentioned, okay, you go through this, 8 to 10 visit treatment plan that Dr. T graciously taught, and you take them through this awesome plan. And then after that plan, how long do these results last? Do you often see that people decline after when they come back in a couple months later? Like, how long lasting are these results? What are you seeing in your own personal experience?
That's really dependent on the patient's condition and how severe they are. I recently had a patient, I did her knees. We finished her care plan 7 months ago. And I saw her on my StemWave schedule to come in. And I thought, oh, well, hey, maybe her knees has, started hurting. She comes back and says, my knees feel great. My hip is bothering me. I want to do my hip. So most patients get relief that has lasted 6, 7, 8, 9 months.
Yep. Yeah, and the
I
data.
haven't had too many come back, say, hey, it's back to where it was before. I've had some who've come back and said, hey, I like to continue to get some treatment because sometimes I feel a little bit, but I remember how I felt before.
Yeah, and you mentioned something interesting there, which is she did her knees and then she came in for her hip. How often are it's more common than not that patients aren't just suffering from one specific area of concern. So how often are patients coming in with multiple areas of concern? Is that a majority of the patients?
Mostly, the majority, mostly. Yeah. It's usually, if it's one knee, it's both knees. If it's a shoulder, we check the other shoulder. I had a patient who came in and she wanted to do her shoulders and her knees and her thumbs, and they had multiple, like 6, 7 different areas that they wanted to do. I said, well, 3 areas the max. That's what we're gonna do. Number of patients we get, I've done lower back and the hip. After that, we just started on their knees. Then we're gonna do the shoulder. So the patients do see the benefit and they do come back.
And what level of improvement do you, as you're going through these multiple areas, you're taking them through the, twice per week in the first week, twice per week in the second week, and then once per week after, you're doing the 8 to 12 treatments, you're doing all of that, you're taking them through that. What are you expecting when you see them next, right? You end a visit here, you're going to see them next Friday. What level of improvement are you seeing week to week? Because, we get so many videos from, I can't describe to you the number of inbound videos we get every week of somebody who is just, ecstatic about the level of improvement they got. But on a week by week basis, what are you seeing in your office in terms of level of improvement for patients?
10 to 15%, and they usually maintain it. By about the 4th to 5th treatment, if they're not about 50% better, then I kind of look at what am I not doing correctly, or what is it that they have done more often than not to prohibit them from getting better faster. They feel so good, then they come in. This has happened a couple of times. One in particular, gentleman, we did about 3 treatments on his knee, and his 4th treatment came in. He goes, "Oh, my knees are killing me." And I said, "Well, what we last time we looked at all the parameters, everything that we did, said there's no reason for you to have knee pain. What have you been up to?" So, "Well, I felt great. I went for a 6-mile run." So
Yeah.
sometimes it's what the patient is or is not doing.
Okay.
But
And so,
a
like,
fifth treatment, I want to see at least a 50% and normally do improvement.
that's great. And what if you didn't, for example? Because I know some people in the crowd may have concern, like, okay, well, Dr. Youdeem appears to be really talented. Like, what do you do if you don't get that level of improvement? What if they weren't running 6 miles and you weren't getting it in the 3rd visit or the 4th visit, you weren't seeing much? What would you do in that circumstance?
What was that point? It's kind of back to the drawing board. You do anything just like any other, excuse me, any other procedure, any other treatment you do in the office. Something's not
Mhm.
working, you need to go back, reevaluate. Maybe you need to get an X-ray, or if you have an X-ray, you might need to get an MRI. Maybe you have there's some other contributing factor that's going on. So a
Yep.
reevaluation, you got to evaluate your patient every time they come in. Just don't assume that, hey, they're doing great, I'm gonna keep going. But every visit they come in, I ask them. Every visit they
Yeah, and the
come in,
good
kind of
news
do
is for
a minute
you too, like
evaluation.
it, luckily we have a community here full of, hundreds of doctors that it's like, if something wasn't going as planned, there are people all across the country who have been through this. They've done exactly what you're doing. They've dealt with exactly what you're doing. You know, we've got Dr. T in Pittsburgh. We've got Dustin here in Fargo, North Dakota. We've got people all across the country that you can literally message them and say, here's what I'm seeing. If you got imaging, you can share with them, of course, in a compliant manner. And, anything we can do to provide feedback there. So, shifting gears here, um, I have a couple more questions before we go to the live Q&A. And if you're watching this, whether it be on Facebook or in the Zoom call, feel free to prepare any questions that have come up about the technology as you're going through this process, or as you're sitting here on the live call. If you've got any questions, feel free to shoot them in the chat, and we'll do that in just a couple minutes. But before we go there, I'd love to just kind of shift gears and ask you just a little bit about how this has changed things for you, because prior to doing this, really for the first 26 years you were in practice, you were primarily neck and spine, or you might have been doing some extremity work as well. But
Right.
it seems like this may have changed the way that you look at your role in your community. And I'd love to just hear how this has changed things for you in that manner.
Every patient that comes in, we actually now begin to look at them through a different lens, and that is there something else I can help them? Can StemWave make a change for this patient? What has changed for me is actually I kind of, I'm not ashamed of saying this, but kind of am ashamed of saying this, is before this I was just getting tired of practice. I was getting tired of you see the same thing every day. Everybody comes in, okay, you adjust them, they get better, or whatever else for neck and spine. I feel as if like I'm back 25, 26 years ago when I first became a chiropractor, where I was excited to go in there and adjust people and change the world. And I'm doing that again with StemWave. I'm excited to
Mm,
come in. I'm excited to see conditions. I'm in close to a year. I'm still excited when a patient comes in. I do treatment with them, and they stand up and they say, "I feel better," and that's my goal. That's very rewarding and satisfying.
that's amazing to hear. And you say that it has changed the lens that you look at with patients that come into your office. I'm curious how it's changed the lens when you're just out in the world as well. Like, you probably see tons of patients that you can help. I'm sure there's people in your family that are like, hey, can you help me with that? Like, is that the conversation that is happening now?
It is. It is. It's again going back to when I first started practicing chiropractic. You walk out in the world, you see somebody that have back pain or their gait is off, and you say, hey, this is what the problem is. I'm now I have been diagnosing people on the streets or with friends and family, and we talk to them. I bring them in, and again, they're amazed by it.
Yeah, I mean, one of the complicated things that we often hear
Mhm.
in passing with a lot of our PTs or chiros is that, really a small percentage of the community, really the US, a small percentage of the US actually visits a chiropractor every year. And even physical therapists, it's really not much better. There was a study that came out not too long ago showing when presented the opportunity for outpatient PT services, only 10% of people took the opportunity to do it. And so the opportunity of patients to work with is just so narrow. And so, what the technology does is really widen up and broaden the spectrum of people that you can help and serve. And if you're getting such good results like you are, it seems like it's just the right avenue and the right path to go. So as we shift gears here, the Q&A side of things, I just want to, acknowledge and congratulate the success that you've had here in just,
Thank you.
11 months. It seems like I've known you for like a lifetime now. That's why I asked. I'm like, has it been 11 months? It's really been 11 months. I feel like I'm growing
Yeah.
up with you at this point. Uh, no, but it's great. And so I'll shift gears. I've got a bunch of questions that are coming in over here on the Facebook side. Um, One of them was, and I don't know if you can answer this. I know we have Dr. T here, who I do know that he has experience with this, which is I use a laser right now. How will this be better than my laser?
Oh, I can tell.
Yeah, yeah,
I was gonna say,
Um,
I know he knows the answer to this, 110%. I know he knows.
yeah.
Gil, do it. Let's call him Uncle
well,
Gil since you
I'm
grew
I'm
up.
gonna go from my perspective. But I'll let you dive into more of the technical. How about that? Okay. How is this from laser? Just patient response right away. A patient who gets laser may or may not stand up right away and say, I feel better. So their perception and the degree to which you give them relief with StemWave is head and shoulders above what you can get with laser. I have laser in my office. I do use laser in my office, but more and more I've stepped away from laser and more into StemWave
Mm.
because the results that I'm getting with it are far superior to my laser. But Dr. T
Okay.
can, I'm sure he has something to add for us.
Yeah, if you
Can't
have
hear you now.
anything you want to add about your experience, feel free, Dr. T.
I mean, if you guys want me to, I just came in to,
Dr. T, we would love
yeah,
if you would add.
yeah.
We would, no, honestly.
Gil has done a fantastic job in the time that he's been here, 110%. With laser, laser, when I have a US patent on my lipo laser designs, and so I understand the phototherapy stuff incredibly well. And he's absolutely 110% correct. Laser is a wonderful healing modality, and it does a lot of the same things that the shockwave can do. But think of this as laser on steroids. We had ultrasound, e-stim, shortwave diathermy, blah blah blah. We had all this stuff. Then we got laser with it, which was this huge jump. Now shockwave is like magnitudes higher. You get an instant response with a patient. You can get the patient to understand care. You can, from a business perspective, we always talk about, doc be the doc and do the best thing for your patient. But let's face it, it's all, they say, it's not personal, it's business. For those of you on the call that have their own businesses, it seems pretty personal, right? Every time you do anything with anybody. So we need something that's going to get this patient to understand that they can get great relief, better results than they've gotten anywhere else with any other modality or in any other office anywhere. And that's what Shockwave does for you. So, I haven't found anything that gets the patient to understand and commit to care faster than this or give us better results, which is the main thing, number one. So I have laser, I have diawave, diawave lasers. I have two of them, a 30 and 60 watt laser. I use them mostly for TMJ stuff now, hardly anything else. Open wound and any open wound stuff, which we do very, but yeah.
So, I mean, I'll ask a follow-up question, to the both of you guys on that, which is, and I know the answer, but I'm more asking for the community, which is, Why is it so important to get improvement in that first visit?
Your
Well,
call, Gil. You
that's
get
what
first, always.
and that's what the patients came to us for, right? They came to us to have improvement. And you have to demonstrate to them that you are the person who can deliver. You are the person that can understand the condition and diagnose them correctly and get them feeling better. So what better way of doing that than by the time they leave the office, they're already feeling better. You need to gain their trust and their respect, and that's what you can do with Shockwave. They feel better. The rule in my office has always been, even before I had Shockwave, I always tell patients, you got to feel better leaving than when you came in. If you don't, you don't leave. I don't have to do that with Shockwave. I mean, I know that they stand up. I feel better. Okay, that's what it is. That's what they're looking for. You have to show them that you can do that for them, and you will.
Great. Great. Yeah, we've got some more questions coming in here, so I'll shift gears, and I appreciate you guys nailing that. I've got another question coming in from Dr. Robert. We've got a couple questions, so we'll make sure we get to all of them. How did Dr. Youdeem's income change by implementing this technology? I know you mentioned that income wasn't even a primary decision maker for you, but I'm also curious, like, how did things change on the back end for you?
We added probably on the average at least $15,000 to $20,000 a month.
And like, reverse engineer for us. Like, how do you get there? Are you selling packages? Like, what is happening? Because, you know, people might hear that and be like how?
Well, a patient comes in, if they have one joint, we charge about $1,500. If they have two joints that we're doing, it's about $2,600. So you sign up 10 patients, that's 2.5 patients a week. There you have it. I mean, there's your $20,000.
Yeah,
it's
pretty straightforward math.
My numbers. You know.
Yeah, I mean, we always like to say
there,
it's like you have to try to make this thing not profitable.
right. And you know, if you focus on the patient, I've always been patient focused. You focus on the patient, do what you're supposed to do. The rest of it will take care of itself. You make the patient feel better, you apply it correctly, and you'll make the money. But then you have patients who come back and buy more packages, and they buy maintenance packages. So that's how you get there.
Dr. T, jump in here.
I'll tell you how to not make it profitable. Don't come to a training. Think you can do it on your own, and don't come to a training. That's what you do. We've seen it countless times now. Not countless. There's a number somewhere. I just don't know what it is. But it's every time someone calls me and says, Doc, what's going on? What's wrong? My first question is always, did you go to a training? Did you see myself or Dr. Barton? Because I know you didn't see me. Did you see Dr. Barton? And they say no. I don't have anything to tell you until you get to a training. Once you get to a training, it's night and day. I know this. I've been practicing for 30 years. I'm talking to guys that have been practicing as long as I have and longer. We think we know everything. We know exactly everything. We could do it on our own. We could get to a training. You want to shoot yourself in the
like
foot?
having the keys to an F1 race car and you have no idea even how to turn it on.
Correct.
Right? It would be completely worthless. And that's why we include training with every single order. So 100%, it's super important.
And it's not hard. I mean, that's the thing. It's not like you go to a training and there's like this secret code and like it's, you know, Bitcoin encrypted, whatever, you know, it's like, it's not that. It's just there's simple, basic principles that you have to understand about the machine, why, when, how, what to do. Gil knows all of them. Gil's been one of the best, quote unquote, students, I guess, or docs that I've worked with. It's one of the reasons he's doing this today. Get to a training. End of story.
Get to a training. You heard it here first, folks.
I had my machine for 3 weeks before I got to training. I was chomping at the bit to actually go.
And those were three wasted weeks, Gil.
They were.
Would have been 30 grand a month, and he blew it.
Dr. T was wasted time. We've got a couple more questions coming in here. We've got one from Kyle, one from Robert, another one from Kyle. So I'll fly through these ones. Do you find better results when you do the same amount of treatments over a shorter period of time? So instead of spreading it out, stacking it together? I'll let all you guys kind of chime in on that.
Well, there's a physiological effect that we're trying to start up. That's why we do it twice a week for the first couple of weeks. We want to get that the immune system to start responding. So we, just like any other treatment plan that you do, it's important to stick to the plan. It's important to what am I trying to say here? It's help me out here, Dr. T.
Yeah, I mean, here's the thing. There's a science-based approach to this.
You're making me sweat here, Doctor.
I apologize, Gil, because you're killing it, man. You're doing a great job. Healing. Here's the answer. Healing takes time. Period.
Yeah.
Healing takes time.
Yeah.
If you know what you're doing, healing takes time. It's the reason for the twice a week, once a week thing. We're trying to start a reaction and continue the reaction. If you have diabetics, metabolic wrecks in your office, people who are just generally unhealthy, they're going to heal more slowly. Again, this machine is a healing device, not a pain control device. It will control pain, but if you bought it for pain control, you're missing out on it. You're missing out on why you should be using it and why you could be making, from the business side, $20,000, $40,000 a month. Again, that's not my, it's wonderful, but it's not that's not what we talk about mostly when we talk about healing patients. Healing patients, happy patients will refer and pay gladly for cash. That's where we want to be in today's marketplace. But the answer to the question is healing takes time. Right?
Takes time.
Yeah.
That's right. So we'll skip here to the next question, which is from Dr. Robert, who, Dr. T, you'll love this one. And Dr. Gill, you may know this as well, because I know you explored all the market, which is, I'm considering adding shockwave. What would be the benefit of focused versus unfocused? And I think we should quantify this just a little bit deeper, because what he's probably more asking, and you can correct me if I'm wrong, Robert, which is, I'm looking at StemWave, and then I'm also looking at some unfocused technology. What's the difference? Feel free to chime in if you'd like, by the way. Yeah, so Dr. T,
Well,
I'll let both of you guys.
Go ahead, Dr. T.
Yeah.
And then I'll.
I did not come on here to answer your questions, Gil. I wanted to see how great you were, but I will be happy. But I'm letting you run with it. I'll jump in if you want me to.
So it's kind of like, you're standing there in front of your professor, and you're getting.
I knew it.
I'm gonna get graded here.
No answers are wrong, and if they're wrong, I'll make sure we jump in.
Robert's like, okay, the clown show's here. Robert doesn't want anything to do with us now. Go ahead, whatever. Robert, how did you ask your question again, buddy?
It made sense to me. Yeah. Again, I brought a lot of my experience from chiropractic over, and to me, it just made sense that when I adjust, I'm really trying to be as specific as possible. When I'm with StemWave being a focused beam that I can really focus on a particular tissue and treat that tissue, it just made more sense to me to focus as opposed to unfocused. With the patient biofeedback that we get from it, that helped as well. That was my reasoning when I was making my decision in the beginning.
Yeah, I think that's a great point. And Dr. T, you actually have both. He has StemWave, and then he also has an Ortho Gold 100, which is an unfocused unit. So you can talk about your personal experience here.
Yeah, I mean, I have the SoftWave. We're allowed to say it, I guess. We had a SoftWave first, and then I decided to go with the StemWave. And I think there's a couple of reasons. StemWave being a focused device, they talk about the SoftWave being an unfocused device. It's really not an unfocused device. It's a long focused or a soft focused device. So that without getting into the physics of it, think of the SoftWave as a shotgun and the StemWave as a rifle. Now, when you get good with a rifle, you don't need a shotgun, right? So, right. I see Robert. He's like, yeah, I get that. Okay. So for me, I always like to talk about the device as you can use it as a diagnostic and therapeutic tool. So with that said, if you're pointing a meniscus and that meniscus lights up, it's the meniscus. If you're using something else, it could be meniscus, it could be, AC joint. It could be, it could be a bunch of stuff that's in the tibial plateau. It could be all these things. But when you're using the StemWave, you can really pinpoint it. You can do a better job of diagnosing. I mean, I do very little MRI now. We do still do some if I think I need it. I don't have any problem doing it. But, I can really get in there and decide specifically what's happening and what we're treating. So for that fact, it's the best tool for the job for me, and I think for most practitioners who are specific, the way Gil said, its specificity is the most important. And for me on the other side, it's as far as a business decision, I find it hard to make a business decision for the SoftWave. The SoftWave is incredibly expensive to use. It's not a bad machine. It is. It's more expensive, and monthly you're spending a lot more money to get it to run. So if it was just on the patient results with being good with it, StemWave still wins. That's why I have a SoftWave and 2 StemWaves. So I think that helped to answer your question. Rob, unless you have anything else.
Oh, thank you.
Right.
Yeah, and the other thing I'll add to that, Rob, too, and by the way, thanks both of you guys for kind of going in depth there, is outside of the technology itself and the physics and the science behind it that we talked about. The approach that StemWave takes is completely different than any other medical device company that most people have worked with. We apply a completely different approach in the sense of when the device is delivered, that's when the relationship starts, right? That's why we're 11 months into a relationship with Gil, and we know him quite well. And so we take the training very serious. We take the marketing very serious. We take every step-by-step process very serious.
I'd like to add something to that. Especially, and that's the marketing that you just mentioned. There have been other devices, my decompression machine, and other things that I've bought. StemWave's marketing and what you guys have helped set up for us, and for us to go out in the community, and even starting within our patients, has been absolutely great. There's no equivalent to that. You have done an excellent job. You guys do an excellent job of setting the doctor up for success. I'm not a marketer. I'm not a I was never one to go out there and trip people in here. But with StemWave's help, that's why I'm successful with it, is because of the marketing department that StemWave has come out and helped do everything. Help
Yeah,
us
and I'm not one to like toot our own horn either, Robert, but we've worked with about 360 practices at this point. In every single practice that we work with, we include a 100% no questions asked satisfaction guarantee. So if anybody doesn't love it, they just tell us, and like they don't have to keep it or anything like that. And part of the reason that we do that is like oh, I hope that's a patient. Could be a StemWave patient. We'll find out. But yeah, and we, of the couple hundred practices we worked with, we've had a 98% success rate. And part of the reason is just we apply a science-based approach to it every step of the process, with training, with marketing, just making sure it goes right without overloading your practice or taking too much time. We're pros at that part. So we'll shift gears here to the next question from Kyle, which is, what are the price breakdowns? You said 1 joint, 3 joints. How does all this work? So I think they want to know the price per session, price per package, and just like how's that working?
So that really comes down to first, what your community can bear. I mean, it's all right. What is the community that you live in? The first joint, you just think of it this way: you set it up. Some of it is just time-wise, how much time you have to spend with the patient. If the patient's already in your office and you're doing 1 joint, the second joint is just, they're already there, prepared, ready to go. So you like to give them a little bit of a break on that. While you're doing both joints, you want to do a 3rd joint, again, that patient, you didn't have to spend any more time, that much more time to set up on a different patient. You think about the cost of acquiring that patient. That to acquire that patient to come in for the first joint, maybe you had StemWave help you and you did some marketing. there was some cost associated with that patient coming in. So when you give them a break in the second and third joint, you have a better chance of having that patient sign up for the treatment, and for them to see what you can do for them, and then from there you can get the word of mouth, and it's all that marketing still goes on with that, right? You have to figure out what your market bears and what you're comfortable with. You can't undersell yourself. You can't overprice yourself either out of the market. Does that kind of help?
Yeah, that was perfect. That was, I think, everything that we were looking for there. Kyle also asked, what is involved in all the training with Dr. T? I mean,
well,
I'll answer the first part. Why don't you tell, actually? What is it? What is it?
Yeah, I'm going to have
What
Gil take that one. Gil went through it. It's not quite Navy SEAL training. It's not. Gil, go ahead. Tell them what you experienced.
So I got trained by Dr. Barton. So I went to Dakota, North Dakota, but I've been making it to the weekly meeting with Dr. T because just the way my schedule works. Training is great. You have the day where you learn about the technology. They teach you. Will teach you how it works, why it works, and then you get some hands-on. Which is important. You can get treatment. You're going to treat the other doctors there and be able to ask questions in a smaller focus group, as opposed to, anything else you could get trained for. That might be hundreds of doctors there. So there'll be more of a hands-on and one-on-one training, so you can get all your questions answered and learn what you need to learn, and then go back and be able to apply it.
Yeah, I think if I may, real quick, Gil, for as much as we talk, and as much as I could have, if I'd have lost that bet. I could have sworn you came to Pittsburgh. I really did, because as much as we're talking all the time,
right.
And that's great. Gil's a perfect example of staying connected to the team and the family and the community is a better word, I suppose. But really, what my goal for everyone who comes to training is to be able to get you guys to hit the target. I want you to be able to hit the target day one. You may not be able to hit the bullseye every time. That will come with experience, but I want you in the game. I want you to be able to hit the target. The way that we do that is we go over how to use a device, what the device does, how, what, where, when, why, and especially how to talk to the patient. Because if you can't understand what you're doing and to be able to meet that patient where they are and understand what they're thinking and what they're doing. And I know everybody thinks that they do, but with this technology, it's a little different. So we spend a lot of time going over that. We spend a lot of time understanding what they're going to ask. These are the questions they're going to ask. So there's a lot of getting the patient to understand what we're doing, and then getting you into training and hands-on. So just learning the device is fantastic. And to be honest with you, it's not that hard. The harder thing is understanding everything goes up to being able to get that patient to understand the technology, proving that it works for them, and then getting them to close. Again, it's not about just the business side of it, but the business side is very important. So, you'll be really good very quickly, just from being here for this one day, 6 hour, 8 hour, 4 to 8 hour, whatever it takes. And Gil's right that we take a bunch of time to, it's a smaller group typically. And you'll have a time to ask questions and show you what we do and how we do it and how I've done it as a high provider, a highly producing provider. And yeah, so that's why I said, for people who don't go, you don't get that. And just, it's really important. So hope that answers.
Super important. And I think that answered Kyle's last question, which was, how long is it? Is it a day? And the answer there is what Dr. T said. It is like a 6 hour, 8 hour thing. And we host them twice every month. On top of that, if you love Dr. T enough and you want more of Dr. T, we host live calls every single week, of which Dr. T, Dr. Barton, and our head of marketing are available, where you can literally just come and do what we're doing right now, which is asking questions. So if you saw a patient case that was maybe confusing, maybe stumped you, maybe you hadn't seen that type of case before, you can come and ask our whole clinical advisory team. On top of that, we have a community here where you can literally just post in the group and ask them what you saw, ask for feedback. And we're all there like 24/7 because it's a community, right? We're here to support one another and make sure we're getting the technology out there and we're getting good results. And Kyle, we also have like a step-by-step training series within our community as well. So like every, condition, every protocol, it's all laid out. So there's a science-based approach to it. So I hope that answers your question as well. And if we've got any more questions, feel free to throw them in the chat. I'm going to go check back over here to Facebook and see if we've got anything more. I know these were all the Zoom questions right there. So Robert, Kyle, I see we got Rodney in here, got Don, Katie. If anybody's got anything, feel free to throw them in.
Just on the heels of what you said, Tom.
Yeah.
As you mentioned, all the videos are there, all the protocols are there, but what I really found helpful was the weekly meetings. And even if I didn't have any particular issues or questions, just listening to everybody else's the questions that they're having it's helpful. It's just the repetition of being able to listen to it and learn from it, see all the different conditions that other doctors are treating or questions that they asked. The learning experience that you can get every week is very valuable, very valuable. That's why I'm there every week myself. I'm still learning.
Love it. Yeah, and I'll, as we don't have any more questions coming in, I'll kind of ask a couple on my own, and we'll close up here. A lot of people who are here on Facebook, and then a lot of people who are here on Zoom, and a lot of people who are watching this recording, they're really just wondering, they've been doing things the same for a long time. They've been running their practice in a certain way for a long time, and maybe the idea of StemWave seems good because they saw some videos online, or they saw some results, or they heard through a friend that could help them grow their business or whatever it might be. But they're still on the edge because they know that it's not free. It costs money. It costs time. You have to make an investment into this with your time, with your energy, and everything. What advice would you give to somebody who's on the edge, wondering if it really is the right direction for their business?
Jump, do it.
You tell them to jump.
Just jump. And well, you gotta take action. If you want to make a change, you gotta take action. If what you've been doing all along, not to say that it hasn't been working for you, but let's just say it hasn't been working for you as well. So, and you want to infuse something new and more exciting and get you, like I said, I look forward to it now. I look forward to coming and treating patients. And as Dr. T keeps mentioning, there is the business side as well. The technology is great. It really, once you've learned how to do it through the training, it does sell itself. You're not gonna fail. I just about guarantee it. If you do what you learn and apply everything, you're not gonna fail. Jump and just do it.
And if you do, there's a satisfaction guarantee. So we don't work with every clinic, honestly. Like, we've met with tons of clinics that probably weren't a good fit, and that's we work with clinics that we think it'll be a good fit. And so as we wrap up here, we've got a couple more questions coming in. One from Kyle, who says, I know extremities get great results, but what about treating the spine, cervical, thoracic, lumbar, SI? I'll let you guys jump in on that.
SIs and lower back do respond quite well. Cervicals do respond well. As I mentioned earlier in the call, when I first looked at StemWave, when I brought StemWave into my practice, I was looking at StemWave primarily trying to treat extremities, and I figured, well, neck and lower back is decompression or adjustments or everything else. But as I became more comfortable with it, and I began to do lower backs and neck, you can still do spine. You're not gonna find too much in the thoracic spine. I can't say I've really found anybody that I'm gonna do the thoracic spine with, and maybe Dr. T can, add to that. But neck and lower back, you will get response, and you'll be able to treat patients with that.
Yeah, Gil, thanks for tagging me in on that. There's if you think about what it does and how it works when we talk about increasing, and we'll get a little bit with this. I know we're almost out of time, Tom, but when you think about how it works, part of the training is to be able to teach you how it works so then you can apply it. So, if you're working with soft tissue with it, it works incredibly well, releasing Golgi tendon organs, releasing musculature, trigger points, those types of things. So if you're applying that to soft tissue anywhere in the body, you're going to get great results. If we're talking about facet syndromes in the spinal column and the paraspinals, you're going to get good results there too. We have to be a little more careful when we're working with CNS in general. But you're going to be taught that stuff, so it's not something to be worried about or afraid of. We just need to do things a little differently. Back to training, right? That's not like a broken record on the training thing, but if you don't know how to use it, you're not going to get great results. Overall, I'll say this as an overlying statement. After 27 years in practice, I've done 10 offices in 6 states, had 8 at one time and 90 staff. I have 2 now. That's enough. It has fundamentally changed the way that I practice. These guys asked me to help with this. And because of the technology and what it does and how it works, I became good at it. I was able to become someone that you guys can trust and learn from. So with that said, today, whether you're adding it to a chiropractic or a medical patient treatment plan, or if you're using it as a true StemWave plan for 10 sessions for a knee, there's different ways of doing it. But either way, I can't imagine practicing without this technology now. And I'm thankful that it happened, and my patients are incredibly thankful. So, yeah, I think that answers some of the questions, kind of an overarching type statement. But when Gil says this guy is salt of the earth, and he's an excellent physician and doctor, and when he says jump, I mean, he means it from the bottom of his heart. He's not being, he's just a good dude. So, and as our everybody on the team and at StemWave. So if he says jump, then he means it. So with that said, that's my answer.
Yeah, I can't think of a better note to close on. So for some of you that are watching this, wherever you are in the world, we look forward to seeing you at the trainings. We meet, 20, 30, 40 new people every month, and we're grateful for that opportunity to serve you. And we look forward to meeting you face to face and showing you what the technology can do. And we look forward to helping this technology impact your office and your community. And that's what we're all here for. So thank you, everybody, for attending. And if you're wondering how to get in contact with our team, you just go to stemwave.com. And again, thanks so much, everybody, for coming.
Thank you for having me.
All right.
Yeah.
Dr.
Good job,
Youdeem,
Gil.
special thanks to you. Dr.
Thanks,
T,
Dr. T.
you as well.
See you later. Thank you,
Goodbye.
Tom.
Bye, guys.
Bye, everybody.